Comment. And then, oh no, Instagram has changed. How do you add people?
Are you're doing it from yours or from the sheet?
From the sheet? Oh wait, I'm on my page.
Yeah.
I'm thinking I'm still logged in on regular Instagram. Lord, I'm like, why is it not going?
I know, because I'm on the sheet equals the change page, and I was like, I just saw Ellen said she went live.
Lord. Okay. Here we go. Put that here. Link tree.
All right, there we go.
Okay. Oh, here. How do you add people?
I request to join.
Okay. So they changed this. How do you make sure? Okay, view request. There we go. Ooh, that makes me nervous. All these updates. Okay, here we go. Oh no, it's a little echo. Is your earphones in?
Yeah.
Okay.
Okay.
Oh, okay, I don't hear anything.
I just muted the. Okay, here we go. Let's see.
And I can hear you fine on the computer. So.
All right, I think we're good.
Okay, let me take this out. So thank you guys for everybody that's joining in. We're just gonna get started in just a second. I see Imani, Tati. Thank you guys for joining in. Leo Burger Rising, Miss Ann, how you doing?
We figured it out, the technology.
Instagram got too many updates for me.
I know. Some of them are good though, because before you used to have to download the video right after you finish, or it would disappear forever.
Yep. You're right about that. So now they're making it easier, but it's just I gotta learn why they're making it easier.
Yeah, and now you can add multiple people. You can do like 4 people at a time.
I saw that, and that's a really good feature. I was on Chloe and
I haven't used it yet, but I'm ready.
Me too. Hey, Samitri. So we're going to just go ahead and just get started. Thank you guys for joining in on today's topic in our session. It's been a while since you guys seen us. This is Sexual Health in Everything. It's a campaign here in the DMV area. Our mission is basically to create a safe space for conversations surrounding sexual health and decrease the stigma for having those conversations. We want to make sure that we create a safe space and then also that you feel comfortable and just reduce the stigma when it comes to STIs, sexual health, and just talking about it, because this is a part of our everyday lives. So we have Dr. Natasha Ramsey here. Okay, I'm echoing a little bit on Facebook. Okay, so let me mute this. Let me see. Okay, so we have Dr. Natasha Ramsey here. She is a board certified pediatrician who is currently in training at Children's National Hospital to become an adolescent medicine specialist. She obtained her medical degree in master's in global public health from New York University School of Medicine and completed her pediatric residency at, if I say this wrong, please don't judge me, Icon.
Yep, you got it,
girl. School of Medicine at Mount Sinai in New York City. She has dedicated her career to serving diverse populations, expanding adolescent medicine workforce both here and abroad in areas of reproductive health, family planning, HIV, teen pregnancy prevention. She's also committed to supporting the pipeline of underrepresented minorities in medicine and public health. She founded Gorgeous Black LLC, a consultation firm with 3 goals: to provide health education and resources to youth and professionals in organizations that serve them globally, to dismantle racism and improve diversity, equity, and inclusion in healthcare, to promote advocacy and wellness through art and writing. She plans to continue her work in global adolescent medicine and commit to diversity with hopes of becoming a leader and advocate in global community, fighting to improve the health of teens around the world. So thank you so much for being here with us, Dr. Ramsey. We appreciate it. And thank you for everybody that's tuning in on time. We appreciate y'all because we're not getting things today. And we're going to try to get to the whole agenda. Yeah, and if you guys have any questions, feel free to comment them. We're going to answer those for you. This is going to be a discussion. This is not like a Zoom. I know everybody's kind of like having Zoom fatigue. This is a conversation. So grab your relaxing wine for tonight. You know, get ready, snuggle up, put your snuggie on, all of that. We're going to have a discussion about STIs because if you don't know, this month is STI Awareness Month. So, okay, so she said, put my volume. Okay, so I turned my volume.
Oh, shout out to the Pretty Period. I don't know if you guys are following them, but it's an awesome organization. They give out free period products to people in the DMV. So definitely follow. Check it out. Yep, y'all need to connect. Go ahead and connect.
Yeah, we do. Thank you, the Pretty Period. We appreciate you guys being here today. And yes, we're going to have to connect because that's important as well. So we're just going to get started and see what you guys already know. And when we talk about STIs, there's just the language has changed over the years. So I remember watching a Tyler Perry film, and they was like, "I got VD." I was like, "What is that?" But then he had, STI, and then you hear STD because I see STD Awareness Month, and then STI. So the language has changed over the years. Why has the language changed, and is it the same? Is it different?
Yes. So VD stands for venereal disease. And obviously that sounds terrible. So I think that's probably why they moved away from that language. STD stands for sexually transmitted disease. And then STI stands for sexually transmitted infection. So you'll hear people use all of them interchangeably. A lot of the old school people use venereal disease. But sexually transmitted infection, I think, is the best way to characterize these type of infections because they are truly an infection. Sexual transmitted disease implies that it's like you have a disease that you're gonna keep. If you have diabetes, you have a disease. Versus sexually transmitted infection, which is more like you have something that we could treat or not treat, and then it goes away or it doesn't go away. So I think that's why the nomenclature has changed because it doesn't make it, I personally think it takes away some of the stigma. When you say someone has a disease, you're like, oh, you got a disease, it's like you're sick. Versus an infection where it's like you can have the infection, but you may not necessarily have the clinical symptoms associated with the infection, if that makes sense. And we'll talk a little bit about that later on tonight, but sometimes people can have an STI and have no symptoms. So you can still have the infection, but not have symptoms. So I think that's where the name change kind of came from.
Okay, nice to know. Thank you for explaining that. So a lot of times as women, we go to the doctor and we can have a lot of things that happen with our reproductive system, such as everything, because we create life and it's just so many things that are different from our reproductive system compared to men. So I wanted to ask you, can vaginal infections increase the risk of STIs and how are they different?
Yes, that's a great question. Okay. So a vaginal infection means infection in general means that a bacteria or a virus or there's other things called protozoas, which is a whole nother class. But that essentially means that some type of organism has caused inflammation to your vagina. Now, there is lots and lots of bacteria and yeast in your vagina already. That's just where they live. That's just how it is. And that's why when you do things like douche, which you should never do, or other things that throw off your vaginal bacteria or the balance in your vagina, it can cause problems. Now, yeast infections are an example of an infection, but it's not sexually transmitted. Bacteria vaginosis is another example of a vaginal infection, but it's not sexually transmitted. So bacteria vaginosis is when the bacteria in your vagina is imbalanced. And the bad bacteria that normally is kept in check overgrows, and then you get a funny smell, you get lots of discharge. So that's bacteria vaginosis. And then you have your run-of-the-mill sexually transmitted infections: gonorrhea, chlamydia, syphilis, HIV, herpes, trichomonas, which is the one that's a protozoa. Those are all sexually transmitted. And they all like to kind of run in pairs, because what happens is when you have inflammation in the vagina or in the cervix or anywhere in the reproductive tract, then the other bacteria is like, oh, it's a party, I'm going to. So a lot of times we'll see people have a yeast infection and then also have chlamydia, and then they'll also have gonorrhea. So you can have all of them at the same time, because they all cause inflammation and irritation to the reproductive tract. And then it opens up it makes the vagina and the reproductive tract more vulnerable to being infected by something else. Oh, hey, Fiona.
Okay. Oh, yes. No, we appreciate everybody joining us today.
I think I saw someone else. I think I saw Nat in here and Tara. Hey, y'all. It's a lot of healthcare providers and people who take care of adolescents and do sexual health also on the chat. So y'all can chime in if y'all agree with me about these things.
Yes, please do. So with all that being said, and there's so many STIs out there. I think I was reading an article last year and they were talking about how different STIs are emerging in different countries. But with that being said, we always hear about trick. And I think that's the one that kind of throws everybody off the loop. Like, what is trick? Is it like BV? It's kind of the same symptoms. So can you explain a little bit about trick? Because we hear about all the other ones, but trick is like the ones like, what's that?
Yes. So trichomonas is one of the STIs that is commonly forgotten. Like, people always forget about that one. So trick, like I mentioned, is a protozoa. So it's not a bacteria. And it's like kind of like it's hard to explain. It's just this weird organism. And it has like a little tail, and it called the flagella, and it just like moves really quickly. And it's just like a very just weird, weird infection. But symptoms that people can have are very similar to the other STDs. So you can have vaginal discharge. In medicine, we say that you have a strawberry cervix, which means that your cervix, when we look at it, is so red and irritated that it looks like a strawberry. And then also people can have pain with sex. They can have like pain or irritation with urination. So it just can be like a really annoying infection to have, because it can be very irritating to the reproductive tract. The crazy thing is there are some people who have no symptoms. So girls and guys can have trichomonas and have no symptoms. The other problem is there's not good guidelines on checking for trichomonas. So with gonorrhea and chlamydia and HIV, there's lots of guidelines that doctors and other healthcare providers are very good at following. They're like, oh, I should screen you every year for this. I should screen you every year for that. But not everyone screens for trichomonas or checks for trichomonas when you come in with symptoms. So it's important for people to know about trichomonas, so that when you do go to your doctor, that you ask them to test for it if you're having symptoms. But it is one of the ones that people often don't know about and don't ask about. But it can be asymptomatic. You could have it and not have symptoms. And the other thing that people, with all these STDs is that, or STIs, I should say, if your partner has it and you have it and you get treated and your partner doesn't get treated, you get it again.
Yeah, ping pong.
Yeah, just send it back and forth. So I always tell my patients, did he get treated? Did she get treated? You could bring them here. We could treat them here, please, because otherwise you're gonna be back. And I definitely have had patients whose partner didn't get treated, and she came back to the clinic and she was like, Dr. Ramsey, I need you to treat me again, because he didn't get treated. He told me he did. He didn't go. He never took the medication. And the second time she went with him to the clinic, and she physically watched him put the medication in his mouth. So it happens. It happens all the time.
Yes, and we're going to actually talk about disclosure, because that's another thing that we were interested to learn more about. But I do want to ask you about crabs, because there's an ongoing myth about people of color, especially Black people or Black folks. We feel that we cannot get lice, So with that being said, is it possible for us to get crabs? Like, because I know that's pubic lice. So
yes, absolutely, 100%. Yeah, absolutely.
Wow.
So the thing about lice in like your hair on your head is that the hair, it's easier. Actually, a lot of people have this myth that if you have lice that your hair is dirty. And the truth is, if your hair is very clean, it actually is easier for the lice to move around. And so lice actually like hair that is very straight and also areas that are very clean. So like easy to move around. So there's all this stigma around lice that if someone has it, they're dirty, and that's not necessarily the case. So, but definitely pubic lice it does not discriminate. You can still get it. So,
okay. And it's transmitted in different ways. So I heard people get it from like tanning beds and then using, so is that possible? Like even if you slept in the same bed as someone, is it possible to get the crabs?
Yeah, it's more likely if you have direct contact with somebody who has it. So like we call it fomites. So there are certain objects that certain types of bacteria can travel on. But really the easiest way to get it is direct contact with somebody who has it. So I've had patients who are like, oh, when I have sex, I don't even look down there. I just lights off. I don't even know what's going on down there. And I always tell them that's not a good practice. Like you need to know what it looks like. And you might be able to see if there's something abnormal going on down there. So I always recommend just taking a look, making sure you know what's going on before you engage in any type of activity. But definitely it's easier to pass. It can be passed through fomites, but it's much easier to pass with direct like human contact. So
okay, that's good to know. So next I want to kind of get into transmission and treatment because we kind of talked about how crabs is transmitted. And I want to know, okay, so these are the questions that we really, like people really want to know. And so what do you do if you're having a casual sex with multiple people? Because you know hot girl summer's coming, we've been inside all year, and everybody ready to I saw the article in the New York Post, everybody's ready to get back to it. So with that being said, if you're having casual sex with so many different people and you come up with an STI, but you don't want to admit that to your partner, when should you admit that you've been given an STI in the first place?
Yes, that's a great question. So I think, that goes back to kind of that whole discussion about stigma. There's a lot of stigma around STIs, and unfortunately, they're very common. So a lot of people have it. I diagnose it at least once a day when I'm in clinic. Like it is very, very common. So that's the first thing. So I think we just have to like get rid of the stigma first of all, that like having an STI is like something that is only your fault and like you're a terrible person and like that's why it happened to you, because that's not the case. It is very common. So the other thing is, I would say the most important thing if I could impart this on everybody during this whole hour, this is the most important thing I want you to know. You know your body. Know your body so that you know what's abnormal and you know what's normal. And then also get tested so that you know your status, you know where you stand, and you know what's going on with your body. And if there's any changes or deviation from that, then you know that something is going on. Just give me 1 second. So that's the first thing. So everybody write that down. Make sure you remember, know your body. There's a question. Okay. We'll get to that in a second. So that's the first thing. The second thing I will say is a lot of times STIs can be asymptomatic. So you can have an STI, not even know that you have an STI, be in a monogamous relationship where you're like only with that person, give that person an STI, and then they're like, "What? You cheated on me. How did this happen?" No, I had it before and I didn't know I had it, which is why it's important to get tested and know your status. So I think when you're a single person out there living your life, know your status, know your body, get tested regularly. So that way, and I would recommend if you're not in a monogamous relationship, at least every 3 months, getting tested for like gonorrhea, chlamydia, like some of the most common STIs. If you're in a monogamous relationship, when you start that relationship, both of y'all get tested. So that way you're on the same page. You know exactly where you stand. Now, if you run into a situation where you found out you have an STI and you're like, crap, I don't want to tell my partner. I'm embarrassed. I don't want them to spread rumors about me. I don't know what to do. There are free texting services where you can actually put the person's number in and it will send them a text and say, someone that you've been like intimate with has been diagnosed with an STI, you should go get tested or go get treated. The other thing is expedited partner treatment or therapy. And that is for certain STDs like chlamydia and trichomonas, where you just take medication by mouth. The healthcare provider can actually give you a script for your partner.
Oh, wow.
And they can go to the pharmacy and fill a prescription for the medication without having to see a provider. And that's called expedited partner therapy. And so that's another way that you can make sure that you and your partners are protected. So I just gave you a few different scenarios.
Yeah, no, those were great. Those were great.
Get tested, get treated, know yourself, know your status. And don't be afraid to talk to your healthcare provider. If you're like, I don't know what's going on, and like I thought I didn't, and maybe I do, and I was with this person, and like they put it in, but they took it out, and it was halfway. I'm like, I don't know. Just go to your doctor. just come see.
Yeah. So we do have a question here. What are some ways to eliminate stigma around getting checked for STIs? There's so often embarrassment and reluctance behind going to the doctor. How can we reduce that?
Yes, that's a great question. So I would say, number one, there are clinics that are specifically for STI testing, and those clinics tend to be a lot more, they tend to be quicker, I should say, because they're only treating you for like that specific thing, and they also are better at being anonymous. Mm-hmm. So for instance, the Department of Health and Wellness here in DC, they have a STI clinic, and I believe they serve adolescents and they serve adults as well. And you can go to the clinic and they will call a number. They won't say your name. They'll be like, number 4. You go in, they ask you what you need tested. They even give you the swabs for you to test yourself. So we call it triple site testing, because at the end of the day, it doesn't matter what you identify as or who the person you're having intercourse or whatever with identify as. What we care about is which sites are you using. Are you using your mouth, anus, vagina, or penis? And is that interacting with anybody else's of those 4? If there's any contact between any of that, we need to test it, because you can get an STI. So at places like the DOH, you can go, they give you a bag, you swipe everything, you give them back the sample, they call you with the results, and then they even give you the medication to get treated. So places like that are streamlined for that kind of thing. The other thing is there are a lot of online testing kits. So there are some websites where you can actually sign up to get a free STI testing kit. They mail it to your house. You do it in the comfort of your home and you mail it back. Those things obviously take a little bit longer. So that's like if you're not having symptoms or you're not worried that there's something else going on.
And I also kind of wanted to plug, if you go to if you go to the Linktree, we'll actually have some resources where you can do an at-home HIV testing kit. With the HIV testing kit that you can send to your home, and you can just get your results in the comfort of your home. And we also have some other resources for the I Want the Kit too. So that's awesome. Another plug. So there's so many. If you're in the DMV, there's just a lot of resources, and we're gonna make sure we're gonna add that to the to some of the resources that we post after this live, just so you can know where you can get tested in the area.
Yes, absolutely. And I could provide you with some of the resources too that we often share, like the text message service. I can't remember it off the top of my head right now, but I can send that to you too. Because those are all important. You need all different tools, because sometimes you're like, I don't even know what to do. I don't know where to go. I don't want to leave the house. I don't want to go to the doctor, but I'm scared and something's not right. And so we want to make sure y'all covered in every way, whatever combination you want to do of getting tested and treated and et cetera. So yeah, that was, I forgot the question now, but those are some of the things I recommend.
Okay, that was the only question they were asking, because there's so much embarrassment behind getting tested. How do we make it more comfortable, reduce stigma? So the next I wanted to ask you, so what if you're doing, you kind of answered that already, but the question was, if you're sleeping with one person, they lie about you getting an STI, you're saying that there's different services, partner services out there to talk about that, but do you want to add anything to that?
About if your partner lied to you about an STI? Mm-hmm. Yeah, so like I was saying, you could be asymptomatic. And so I have it happen all the time where someone comes in, I remember very vividly, I had a patient, she had one partner, it was her boyfriend, they had been together for a year, she had no other partners, she wasn't someone who was quote unquote high risk, but I was like, you've never been tested, so let's just make sure. Chlamydia. Her boyfriend had it. He had it from before and he didn't know.
Yeah.
And he gave it to her, but he didn't cheat on her. It wasn't like he was stepping out on the relationship, but he was asymptomatic and he hadn't been tested. And so that's why I always recommend, even if you're in a monogamous relationship, just get tested so everybody's on the same page and you know where you stand. It's very simple. Getting tested these days is way different. Back in the day, they used to swab all types of things. Now you can just pee in a cup and we send it to the lab and we check for the DNA of the bacteria in your urine.
Okay.
And that's it. You don't have to, and then we get the diagnosis. It's much quicker. It's much more effective. We don't have to do all these embarrassing things and swab all types of things. Some places still do that, but for the most part, it is very non-invasive to get tested for STIs.
Okay, so now we talked about testing. I just want to know what happens.
Now we talked about testing.
When you go untreated, because our target population is women. So we just want to know, how does that affect our reproductive system?
Yes, that's a great question. So obviously, if you have an STI, like we talked about, an infection can cause lots of inflammation to the vagina and to the reproductive tract. So by having an infection, it's causing inflammation to your reproductive tract, which can cause scarring and other complications down the line. So it is important to, once you know that you are infected, to get treated. One of the main complications that we see with STIs is pelvic inflammatory disease. And what that is the infection goes beyond just the vagina and it goes into the uterus and into the fallopian tube. So I actually have a little diagram for y'all because I'm a nerd. So I don't know if y'all can see this, but this is the reproductive tract. And there's kind of a glare, but these are the fallopian tubes. Now, what normally happens when someone gets pregnant is that they release an egg from the ovary, it travels through the fallopian tube, the sperm meets it over there, they travel down together, they implant in the uterus, and then it grows into a baby. So what happens with people who have PID or have recurrent infection and inflammation to the reproductive tract is that there's scarring of the fallopian tubes. And when you have scarring of the fallopian tubes, then the egg can't travel through the fallopian tube and implant in the uterus. And so people can have trouble with fertility. They can also be at higher risk for something called ectopic pregnancies, which is when the pregnancy is outside of the uterus. So some people can have pregnancies that end up in the fallopian tube. And obviously that's not a place for the fetus to develop. And so people can actually have rupture and bleeding, and it can be really complicated. So it's important to know if you're infected with an STI so that you can get treated so that you don't have issues with fertility down the line. And there's very rare cases where people can get really sick and have a abdominal infection and need to be on like antibiotics and need to be on like medications to help keep your blood pressure up. So it can become very serious if it goes untreated. There's other and that's specifically with like gonorrhea and chlamydia and trichomonas. But there are other STIs that can have really bad effects. Syphilis, which is another one that is like on the rise and a lot of people don't know about and think it's like an old people STI. But the truth of the matter is it's actually on the rise, and it's on the rise specifically in the DMV area. But syphilis actually can cause blindness. It can cause trouble with your neurologic system. It can actually get into your brain and into your spine. So syphilis has 3 stages, and the tertiary stage is very serious, and some people can even die. So syphilis is definitely a serious one, and it can be passed to your child if you're pregnant. So it's one of those that we keep a really close eye on, and it actually is reported directly to the DOH as well. And then HIV obviously can be really deadly if it's left untreated, because it attacks your immune system and then puts you at risk for other infections that can be deadly and fatal. So a lot of people think STIs are just annoying, but they're not just annoying. They can have a lot of other effects on your body.
Absolutely. So when we talk about STIs, we sometimes leave out same gender loving women. I want to talk about that because a lot of times, that is left out of the conversation. What are some common symptoms that common STIs that same gender loving women can go through, and then what approach should we take when protecting themselves from STIs?
Yes, I love this question for several reasons. First reason is, like I said, I don't care how you identify, and I don't care who you identify, or the other person you're having intercourse with identify as. If there is any contact with any of those orifices, then we need to know so that we can properly test you. I will give you an example. I had a patient. She was in a relationship with another woman, and they were using toys. They were not using any protection, like condoms or other things on the toys. But her partner was having intercourse with men. She had an STI. She was asymptomatic, and then she gave it to my patient. So she still was able to contract an STI from using a toy because they were exchanging bodily fluids still. And she had exchanged bodily fluids with someone else. Right. So it's still important to, for people who identify, any of our gender diverse individuals, to still get tested and to still know your status and where you stand. Because if you're having any interaction with any of those body parts, you can still get an STI. And unfortunately, doctors and other healthcare providers do not do a great job of asking questions about that. A lot of times people will make assumptions. They'll say like, oh, like, are you dating men, or do you have a boyfriend? Or they'll make an assumption about like who you're dating, who you're with. And I try very hard not to do that. I'll say stuff like, tell me about your romantic relationships. Like what kind of people are you interested in? But not everybody does that.
Right.
So it's hard because a lot of times people don't feel comfortable asking those questions to their doctor or their healthcare provider or advocating for themselves. But it's important to know that all the STIs that heterosexual couples can get, other couples can get as well, or other people who are engaging in intercourse can get as well. So just advocate for yourself to get all the testing so that you know where you stand, and whoever you're having intercourse with or having any interactions with, you're all on the same page. So that's my generic advice for everybody. Just know.
No, we thank you for that approach. Leo Rising, as Ann just said, thank you for that approach. We do appreciate it. Okay. It is a little fuzzy on your end. For me, I was just wondering if your Wi-Fi and everything is on. Okay. Just making sure it's
yeah.
Okay.
Is the Instagram live fuzzy or the computer?
No, it's just the Instagram live. I'm just trying to make sure. Okay, it's coming back. All right. So my next question is about protection, because we do offer, just to plug it in, some sneaky link packages that have so many different resources in it. So look that up. We got some B condoms, black on. You can have those in there. Internal condoms and dental dams. But with all that being said, I know finger cocks exist. And I just want to know, are finger cocks, are they effective? Because it's like just your finger.
Yes. Yes. So as I was describing those 4 body parts that are interacted, I didn't talk about fingers, but obviously if you have any type of fluids on your fingers, you can then transmit that to, you can still transmit STIs through that way. So HPV, herpes, any of those that are like contact type STIs can actually still be transmitted through touching if there's exchange of fluid as well. So I normally recommend using finger cots, and some people don't, but you still should.
Yeah, I believe in just protection either way.
Exactly. And the other question that I always ask people is, did you use it the whole time for every part? Because people will use the condom for like the first 10 minutes and then they take it off and then they have sex without it for the whole rest of the intercourse. And it's like,
yeah. And another thing that's common is the oral sex. Like they just like, okay, I'm going to put, the condom on for penetrative sex, but then for oral sex, we're not going to.
Yes. And the important thing is you can still get an STI from oral sex. And you can get STIs from anal sex as well. So there's this, I hear this a lot. People will be, oh, I'm a virgin because I didn't use my vagina. But they had sex in every other orifice. Like you can still get an STI. So you still have to use condoms. You still have to protect yourself. You have to use it throughout the entire intercourse. And when you do use a condom, the person needs to walk away and go this way and then take it off. And you can't take it off next to the person because then the bodily fluids can still fall on top of, you just want to separate, then take it off. And there's so many different types of condoms. There's so many different options. Like you just have to once again, know your body and find the one that works for you. And there's different types. There's polyurethane if you're allergic to latex. There's lambskin if you're you're trying to protect against pregnancy. Lambskin, unfortunately, does not protect against STIs. But some people, if you're in a monogamous relationship, you've both been tested and you're like, we still want to be extra safe. You can also opt for lambskin condom. So there's different ones, there's different shapes, different sizes, different colors. Like there's really no shortage of different types of condoms.
There sure isn't. I think I got a little glow in the dark one right here.
Yeah, I can't see this, but I have my little cup here with all my little kits. So this is a cup that you would pee in for STI tests. Obviously, this is sterile, but that's an example. And then this is an example of the tube that we send out for STI testing, and this is an example of the swab. So in some cases, we may swab the cervix just to get a sample so that we can look at it under the microscope and see if there's yeast or if there's BV. And then we can also send that for testing for gonorrhea and chlamydia. This is a speculum. So if we did want to look at the cervix, so like we talked about with the strawberry cervix, seeing if it's inflamed or if there's lots of discharge, we may use this to take a look. But in most cases, we can just check from your urine. But these are some of the other tools that we use to check for STIs. This is my little STI cup.
Yeah, I love that. No, I love that because some people may have never seen it, so now you know what to expect when you guys go to get tested. So I kind of want to ask you a little bit more about transmission and treatment. So HPV is one of our H's. For those who don't know, some of our H's, a lot of ways to understand our H's, HPV, herpes, hepatitis, HIV, is that they're not curable, but they're all treatable, with the exception of hepatitis C. So with that being said, I've heard HPV can go away on its own. So with that being a possibility in that, it's treatable but not curable, do you need to tell your partner?
Yes, that's a great question. So HPV is a virus that can cause cervical cancer. It can also cause anal cancer, and it can also cause vulvar cancer. And certain strains of HPV are also responsible for genital warts. And so the HPV vaccine actually helps you to create antibodies so that in the case your body is exposed to HPV, you can fight it off and kind of kill it so it doesn't cause these changes to your body that can lead to cancer down the line. So the guidelines currently are that you get the HPV vaccine when you are in adolescence, ideally before you could have possibly been exposed to HPV. So most times we will give HPV vaccines when you're as early as age 9, but most people do it at age 11. And then it's like a 2 to 3 dose series that you get throughout the course of the next year or so. Some people get it later at like age 15 or 14 or whatever. But at that point, you may have already been exposed and it's not as effective. Now, pap smears, which you guys have probably all heard of or have experienced. Pap smears are a test where we scrape off some of the cells from your cervix to check and see if there are any changes that could be concerning for cancer. And we can also test for HPV when we get that sample, because HPV, like I said, can cause cervical cancer, and is one of, I think, like 98%, 97%, something like that. Most of cervical cancer is directly linked to HPV. So in young people, you may scrape the cervix and see some changes in the cervix, and you may see that they have been exposed to HPV. And then if you check them 10 years later, they've actually cleared the infection, their body fought it off, and there is no HPV. So that's what people mean when they say like you've been cured, that your body was able to fight it off and clear the infection. Some people are not able to clear the infection. The HPV continues to cause inflammation and changes to the cells of the cervix or the anus or other parts of the body. And then it can move forward to abnormal cells that can then predispose you to cancer. But in most cases, people who are young and have strong immune systems are able to fight off HPV on their own, or with the help of the vaccine are able to fight it off much easier and quicker, and therefore don't have to worry about developing cervical cancer long term. That was kind of roundabout, but hopefully you guys understand.
No. That's great. That's great. And I guess since we're talking about HPV, can we talk a little bit about herpes? Because that's another one. We know with HIV, it's important that you relay your status with your partner, but there's no laws about herpes. So I kind of want to talk about, is it important to share your status with your partner?
Yes, I realized that I forgot to talk about the sharing your status with your partner about the HPV.
Oh, no.
Yeah, so so it's difficult because most people, like we said, most people will clear the infection, and there's not good testing to say like, oh, you currently have an HPV infection. Like it may just, it's not the same way with like chlamydia or gonorrhea, where it's like, I tested you, you have it, I could treat it. Like HPV is more like you may have had it at some point and like it's maybe causing changes to your cervix, but we got to watch it over time and like see what happens. So it's not something that I would say that you can easily disclose to your partners, because you may not even know. Most people are asymptomatic.
Right.
And HPV is actually one of the most common STIs. And most people may have been exposed or have it and don't even know that they had it or have it currently. Genital warts, however, those are obviously visible. And so if you do have genital warts, that is something that you could disclose to your partner. But just having the infection in general, it may be difficult to kind of do that. With herpes, so there's two different types of herpes. There's herpes type 1, there's herpes type 2. Herpes type 1 is typically the one that's on the lips. And then herpes type 2 is the one that's in the genital area. And people can have outbreaks of herpes. And what happens with the outbreaks is that there's actual herpes virus in the outbreak. So in the actual blister, what's the word I'm looking for? Inside the actual blister is herpes virus.
Okay.
So if someone has an active lesion, they can actually pass it to somebody else. And if you have an active lesion on your lip, herpes type 1, like a cold sore, you can actually still pass that to someone's genitals. So it's important. That's why I always tell my patients, take a look. Don't turn off the lights. Get a good look. Make sure you know what yours looks like. Make sure you know what theirs looks like, so that you're all on the same page. If you see something, you're like, what is that? That looks abnormal. So I would say definitely if you have, and people who are known to have herpes and who are taking medication to control their herpes are less likely to pass herpes to other people. So if you have herpes and you're on medication to suppress your herpes, you're less likely to pass it to someone else. The other thing is there's two different ways you can go about managing herpes. You can either wait until you have an outbreak and then take medication to help decrease your symptoms, or you could take suppressive medication. But in most cases, if somebody has an outbreak, they should know, because herpes is very painful. But once again, talk with your partner, take a look. You see something abnormal, take a step back and say, you know what, maybe not today. You should handle that first, then we can circle back. But definitely, I would say if you know that you have an active lesion, you shouldn't be engaging in any intercourse because you can pass it to the next person, and you should let that person know. But if you are somebody who's a carrier, you have it, you're taking your medications, you're suppressing it, or you're not having an active lesion, that's your decision if you want to disclose that information or not.
Okay. So I kind of want to go right back to HPV because there's also been myths I've been hearing about when it comes to like finger warts, or what do they call worry warts. So if you have like warts on your fingers, on your hand, kind of like I guess herpes or herpes 1, can that also transfer to genital HPV? I'm sorry, I hope I don't.
So warts on your hand. So warts on your hand can be caused by different types of viruses. Okay. There's a lot of different viruses that can cause warts on your finger, but warts on the genitals are most likely caused by HPV.
Okay.
So it's not, you can't like pass the one that's on your fingers to like your genital area. Okay. But if you have HPV on your genital area, and you have intercourse with someone else and you rub genitals, they can definitely get HPV. Does that make sense? Like if you have like a wart that's just like a regular finger wart, like that one is not, that's another reason why you should wear finger cots. It's very uncommon, but I have never seen it. I don't know if it's a thing. Maybe, who knows, one of those warts that's on your finger, just like a regular wart in your genital area. But for the most part, the warts that are in the genital area are caused by HPV.
Thank you for that. So now another STI is mono. So mono, I guess it's kind of similar to like strep throat. So is that an STI? That's a question. Is it mono a STI?
Yeah,
like a kissing disease?
Yeah, so mono is actually not a STI. Mono is a clinical syndrome. So mono stands for mononucleosis, and it can be caused by most commonly 2 different viruses, cytomegalovirus or EBV, which is like Epstein-Barr virus. So those are not sexually transmitted, but they can be passed from direct contact. And what's more direct than kissing? So people can get mono from kissing each other. But most of the time, a lot of people have had mono or have been exposed to EBV when they were very young. So when you're a kid and you're kind of just putting your mouth on everything and drinking from whatever cup or sipping on whatever straw, you can get mono or get EBV or CMV, but your body doesn't mount this like huge response in the same way. And so you get it, you clear it, you move on. But teenagers and young adults, your immune system is like ready to go. It's ready to party. And so it gets exposed to EBV and it overreacts and creates mononucleosis, where you can have the swelling, the lymph nodes that are swollen. You can also have a splenomegaly. So your spleen is a major site of your immune system. And so you can also get splenomegaly, which is why when people get mono, we recommend that you don't do like any contact sports or anything that could rupture your spleen. And it typically goes away on its own. There's really no other treatment or things that you really need to do for mono. It's self-limiting, but it's not actually sexually transmitted. It's just, you can get it from close contact with other people.
Okay. Thank you for that. So now we're heading to our last 10 minutes.
Am I breaking up?
No, you're not. You're not breaking up. Okay. It is a little fuzzy on Instagram, but it goes back and forth. But on the computer, you're fine. So I want to go ahead into prevention because we're headed to our last 10 minutes, y'all. And I want to talk about PrEP, because advertisement for PrEP hasn't been for cisgender women, and that's honestly what I can say. Like, it just hasn't. So we don't think it's for us. Like, we don't think that we need it. So I just want to talk about, can you just talk a little bit about PrEP and why is it a taboo for us, and just what it is, because some people don't know what it is.
Absolutely. Yeah. So PrEP, it stands for pre-exposure prophylaxis. So PrEP is a pill that you can take every day to help prevent you from getting HIV. So essentially, PrEP contains some of the medications that you would take if you were infected with HIV. But it contains less of, it doesn't contain all the medications, just certain medications to help prevent you from, if you were exposed to HIV, from actually developing the actual infection and disease. So it like kind of blocks it before it can cause damage and get into your cells. So initially, PrEP was targeted towards gay men or men who have sex with men. And then they were like, oh, I guess women should probably use this too. And so unfortunately, the healthcare world hasn't caught up. And so a lot of times people will be like, oh, this person isn't eligible for PrEP. In order to start PrEP, you need to like have like be high risk and like be this and be that and do, and like all these rules they put around it. PrEP is something that teenagers can take. It's safe for teens. It's been proven to be safe for teens. It's been proven to be safe for women. And anyone can take it. If you're interested in PrEP, you can start it. Do not feel like you need to like explain your sexual history away in order to get started on PrEP. If you're interested in it, you should be able to talk to your healthcare provider and they can start you on it. So we, at Children's, we have a PrEP clinic, and also at the DOH, they do PrEP as well. They will actually give you PrEP in hand before you leave. So PrEP is definitely something that is completely accessible and that everyone who is interested should be started on. The one caveat I will say is there's a new, PrEP is typically, the brand is called Truvada. And then there's off-brand Truvada. And then there's a new one called Disclosed. Disclosed has not been proven to be as effective in women because the medication doesn't get into the vagina as good as Truvada or other medications. So I will say Disclosed is the one medication that you, as a woman, should be wary about starting just because it doesn't have the same effectiveness as Truvada. But there's really no reason. Women should be able to start PrEP just as much as males.
Absolutely. Someone just said, I work for OBGYN and I didn't know that. So thank you for educating us with that.
Hey, Beamy.
So we have a question from the audience and they wanted to know, is there any way you can get an STI from self-pleasure? Yeah,
so the answer is no. As long as there's not another person, if you're sharing toys, then the answer is yes. So, but if it's just you and you clean your toys, there's the other thing too is there's different materials that toys are made of. This is like a whole other topic that I don't know as much about and I need to learn more about this. But there's specific material, the toys are made from specific materials to make sure that they're safe and that they don't harbor like any bacteria or other things that can put you at risk for getting sick or having complications from using toys. But what I would recommend is making sure that you buy toys that are safe and that you also clean your toys. And if you're not using it with other people, have at it. No worries. Nothing to worry about. And that's like one of the safest ways that you can engage in sex without having to worry about an STI.
Thank you for that. Someone asked, where can I learn more? So we're actually wrapping up, but I do have one question. So how can we bring more awareness? Because you said the rates are rising in the DMV, especially with syphilis. So I just want to know if we can leave on one note, how can we raise more awareness about STIs and its effect on our communities?
Yes, that's a great question. So I would say the first thing is knowledge. So in order for us to raise awareness, we ourselves have to know more about it. And we have to know more about ourselves. And we have to make sure that we get, like I mentioned, the one thing I want to make sure that you know is know your body and know yourself. And that way, if we take accountability and responsible for ourselves, that's one of the most important ways to help prevent the transmission and the spread of STIs to other people. And if we all do that, then that decreases the rates. But definitely knowledge, I think, is the most important. I'm a huge proponent of sexual health education And unfortunately, in many states and in many cities, sexual health education sucks. So people don't learn about these things. They don't get the information they need about these topics. People are uninformed. They have symptoms and don't know that they need to go get checked, or they don't have symptoms and they don't need to know they need to go get checked. So knowledge to me is one of the most important ways to raise awareness, which is why I do lots of sexual health education on my Instagram and on my website. So that's what I think is the most important, is knowledge. And then the second thing I would say is being able to self-advocate for yourself, because there are going to be times where you have a partner who might say, oh, I don't need to use a condom. Like, I don't like how I feel. Like, we should just do blah, 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 blah. And you need to be able to say, nope, skirt, stop right there. That's not going to work for me. I don't want trichomonas. No. And so self-advocacy is super important. And also with your healthcare provider, being able to say, excuse me, like, I need you to test me for blank and blank and blank because I'm worried about blank and blank. And the last time that you checked me was 2 years ago. And the guidelines say you're supposed to check me every year, whatever. So that way, you know, and you can advocate for yourself. So self-advocacy is another important thing. But it starts with the knowledge, and it starts with you knowing yourself and with you knowing information about your body. And that's why we're here. That's why we're here today, because we want to make sure that people know.
Absolutely. And just to piggyback off of advocating for yourself, if you are kind of hesitant and don't know how to start those conversations with your healthcare provider, we do have an ebook on our STI website where we talk about some ways that you can actually learn how to advocate for yourself in the office and how to be prepared for a doctor's appointment and things like that. So definitely check that out. Dr. Ramsey has some amazing education on her website and her Instagram. So please check it out. They're for bodies that look just like us. I know our textbooks didn't show us bodies that look like us, but you can see what it looks like on us. And if you guys want some more information about where you can get tested, we'll provide that later on this week. And you can expect to see Dr. Ramsey next month with sexual health and everything, because we're going to be dispelling some myths, okay? There's a lot of myths when it comes to sexual health and STIs and just reproductive health in general. So we're going to be talking about some myths and dispelling them so we can continue to get educated. So that's another way you can learn more. We do have a lot of resources for you to get tested. We have our sneaky link packets where you can order on our website. So hit the link in our bio or in our link tree and get the free resources that we have. When you become a STI or sexual health and everything campaign member, you get a lot of free perks. The membership is free, so we're just providing you with continuous sexual education and resources. So, and you get some perks that comes along with it that's mailed to your house. So, like this nice mask. And I won't show you everything, but you get some nice things. So please sign up. Continue to share this information. This is another way that our community can be more aware about these things, because it is plaguing our community. So we just got to continue to be educated. And Dr. Ramsey, where can we find you?
Yes, you can find me on Instagram. My name is 𝗪𝗠𝗏𝗏𝗏, GORJUSDOC. And then also you can go to my website at www.gorgeousdoc.com. And on my website, I actually have free images. So the image that I showed you guys earlier, this one is actually available for free if you subscribe to my website. And then I also have some images available for purchase that are a little bit more detailed. Also, I just created a whole body positive bundle. So I have some images that have like stretch marks on it, like a little bit thicker. So I'm trying to represent for everybody. Please. So definitely check out the website. And if there's any images or other things that you like really need for the work that you're doing, or if there's something that's missing, I'm super open. DM me, email me, let me know, and I can make it for you.
We love that, and we appreciate it so much. So again, expect to see Dr. Ramsey next month for some more information and dispelling those myths. We want to thank you guys for coming out today, and please sign up for the Sexual Health and Everything campaign membership. We're going to continue to push out this information so our community can be safe and protected and responsible. So see you guys next time, and you guys have a great day.
Thanks, guys.
And you guys have a great day.
Bye.